Many patients have questions about what the endovascular device actually looks like, what their blood vessel looks like, how we deploy the device and get it into position to fix their aneurysm. And I'll give you an idea of how that occurs today by showing you some images of a patient that's been treated in the past. This is actually a patient with a thoracic dissection, and a thoracic dissection is actually different from an aneurysm. Thoracic dissection is where there's three layers of the blood vessel wall. There's an inner, a medial, and an adventitial, or the outer layer of the blood vessel wall, the aorta in this case. And in a thoracic aortic dissection, the inner layer tears, the blood infuses through the middle layer of the aortic wall, and that can cause either complete tearing of the aorta, where the blood vessel ruptures and the patient bleeds rapidly, or that can cause more commonly compression of what is the false lumen. This channel where the blood has torn into the medial layer of the wall is called the false channel. That can compress the true lumen of the aorta, and that can cause malperfusion, where there's poor circulation either to the limb or to the gut, in some cases to the spinal cord, causing ischemia, or even to the brain, causing malperfusion of the brain and an acute stroke. And so let me give you an idea by showing you a CAT scan of a patient that's had treatment in the past. So if I can hold my hand here and show you this CAT scan study. This first portion of the study, this is the ascending aorta right here. Here's the arch, aortic arch here, the left subclavian, the left carotid, the right subclavian, carotid coming out the innominate. And then right here is the true lumen. And we can see that the true lumen is significantly compressed. Just to give you an idea of looking on the other side, here's the true lumen after we've treated the blood vessel. So here's the true lumen compressed. This is the false lumen. Blood is in the false lumen. It should not be within the false lumen. That false lumen is pressurized blood, and it's causing compression on this true lumen. And if we walk our way down from through the chest in the descending thoracic aorta, we see that this is the true lumen that's significantly compressed, about 20% of its normal diameter. And we can follow that down all the way into the abdomen, and we can see that the very important blood vessels originating from the aorta are somewhat compromised, although not severely in this case. And so once we go back up to the chest, I'll focus in on the blood vessel after it's been treated. So this is the blood vessel after it's been treated, and we can see that now the blood vessel is expanded. This is the true lumen. The false lumen, the true lumen over here comparatively was small before the treatment. Now it's fully expanded. The false lumen had blood flow in it before the treatment, before we covered the tear and the entry point for the dissection. Now, after we've covered that entry point, the false lumen has thrombosed and allowed the true lumen to expand. And so as we walk our way down the descending thoracic aorta, we can see that the blood vessel has expanded compared to what the blood vessel looked like before the treatment. So that's an example of a treatment for a thoracic dissection using an endovascular device. And if I can get my camera situated here. And just to give you an idea of what that endovascular device looks like. So this is the endovascular device, which allows us to insert it through small incisions or either percutaneously, just through a puncture in the skin. We can insert this device, just to give you an idea of my finger size and the device size. It's much smaller than my finger, which allows us to insert it over different types of guide wires that are threaded up through the artery to allow us to insert this up to a point in the chest, and then we deploy it within the blood vessel. Here I have a model which kind of shows you what that stent graft device will look like within the blood vessel. So this is a model of an aneurysm. This is not really a dissection, but this is a model of a thoracic aneurysm where this stent graft device is deployed within the blood vessel. This is really all just plumbing. And to give you an idea of what the stent graft device looks like, here's a typical stent graft device after it's deployed. So it's a metal stent that's covered with usually a polyester fabric. So that gives you an idea of what the device looks like that's used to treat thoracic aneurysms or even abdominal aortic aneurysms. For an abdominal aortic aneurysm, that device, instead of being a straight tube, may be a bifurcated tube like this. But they all have the same premise of being a tube that's constricted down, placed within a sheath, and then delivered up to the point of treatment and deployed in the native blood vessel to seal either a dissection, in this instance that I've shown to you today, or an aneurysm. So that gives you a little bit of information. That's always helpful for patients to understand, patients and families to understand what needs to be treated, and mechanically, technically, how that will be treated. That sometimes provides allays some of the concerns about how we provide medical treatment here at the Cleveland Clinic. Thank you.